Hi, everyone. My name is Becky McGregor, and I'm your APS Employee Wellness Coordinator. And with me today is Ida Marie Perea, and she is with Presbyterian Health Plan. We are kicking off the proactive pursuit of health and well-being with our 2024-2025 Open Switch enrollment. Open Switch enrollment is October 1st through 16th for benefits that start January 1st, 2025. And Ida Marie is going to just talk to you a little bit about all of the benefits that Presbyterian Health Plan offers. And what that looks like for you. We want to remind you that all of your open switch enrollment information is on one landing page, and that's at aps.edu/open-enrollment. So please go there if you have more questions. But also, we have the Employee Wellness Fair, which is next week, October 8th and 9th, 2:30 to 6 p.m. at Bonifacio Complex. And that is your one-stop place to really get in-person support. Any questions you have about not just your Presbyterian benefits, but any other benefits that we offer, you can have there. And so we encourage you to show up at the APS Employee Wellness Fair next week. But with that, I'm just going to stop sharing this screen and send it over to Miss Ida Marie.
Good afternoon, everyone. As Becky mentioned, my name is Ida Marie, and I am with Presbyterian Health Plan, and I will go over your offerings with Presbyterian Health Plan through your plan with APS for the calendar year 2025. First of all, I just want to go over what we're going to talk about today. First of all, we're going to talk about the plan changes. And the second thing we're going to talk about is how your plan works. How do I access my benefits? New and improved virtual care, press online and how to navigate it, and then also some of the wellness services that are available to you through your plan with APS. So let's talk about what your out-of-pocket is at as a member of the Presbyterian Health Plan through APS. So you do have an EPO plan through Presbyterian Health Plan. And what that means to you is you have co-payments, you have co-insurances and deductibles, but the provider network is what the EPO plan stands for. And what that means to you is that you have an exclusive provider organization plan, similar to an HMO plan. So you will have deductible for certain services, and then you'll have predictable co-payments. But the wonderful thing about this plan is you have an out-of-pocket maximum. And what that means to you as a member is that you know what you're going to need to budget for the year. So for example, for a single person on the plan, you have a maximum that you will pay per calendar year of $4,000. Anything that you pay out of pocket with Presbyterian goes through that to that bucket of $4,000. So your deductible, I'll go over that in just a moment. It's a $500 deductible, and that's going to apply to anything that has a co-insurance next to it. Okay, so you see your predictable co-payments, anything that has a dollar amount attached to it, that's what you'll pay out of pocket. You will not pay a deductible. And as always, your preventive care benefits are paid for at 100%. So there is zero out of pockets. So that means your mammograms, your colonoscopies, your prostate exams, whatever it might be, your immunizations for yourself or your children, that's paid at 100%. So please take advantage of that benefit. But if you have an outpatient hospitalization or an inpatient surgery, you pay your first $500, which is only due once a year. Once you pay that $500, then you pay a co-insurance. So you pay the 20% co-insurance. That goes toward whatever you pay for your deductible and your co-insurance. All of that goes to your $4,000 bucket. Even those co-payments, you pay a co-payment for your primary care of $20, or you have a $50 specialist visit, all goes towards your out-of-pocket maximum. Now, there are some services that are zero out of your pocket, so I'll go over that in just a moment. But I'll also go over and let you know how you can get the less out of pocket for your MRI and PET scans. So when you go to a standalone facility, which means you don't go to a hospital, so you don't go to, for example, a Rust Medical Center or a Presbyterian hospital downtown, or anywhere in the state that you go to a hospital, you go to a freestanding facility. You pay $120 for those services. And for ultrasound and x-rays, there's a $20 per test copayment that you pay per visit. Now, for urgent care, you have a $50 copayment, which is all inclusive. So everything, all the services you do have during that visit, you'll have that $50 copayment and nothing else out of pocket. And then you also have a all-inclusive $350 copayment for your emergency care services. Behavioral health and substance abuse is paid for at 100% by APS. So we want to make sure, APS wants to make sure that your mental health and any substance use issues that you need help with or you seek services for, you won't have to worry that you have to pay anything out of pocket. That is paid for at 100%. So let's talk about your EPO network and how that works for you. So your provider network, you're able to seek services with any Presbyterian contracted provider. Works like an HMO. You are able to go to any facility and physicians group that doesn't have Presbyterian on the door. So we want to make sure that you know that you're not tied into just those Presbyterian facilities or physicians groups. We are contracted with every facility in New Mexico, every community in New Mexico. And we also have thousands of providers available to you within that network. You do not need referrals for specialty care. Elective services outside of New Mexico are not covered unless they're pre-authorized and are not able to be taken care of for you in New Mexico. Out of state and out of country services, how is that covered for you? Well, I have coverage. Yes, you absolutely will have coverage for urgent and emergency care services outside of New Mexico and outside of the country. Now, you also are covered or contracted to go. We are also contracted for you to go and seek services at UNM Medical Group and UNM Hospital. You also have access to the Optum network of providers. Now, that used to be Albuquerque Healthcare Partners, and prior to that, DaVita. So those providers are considered in network for you within Presbyterian. Now let's talk about the exciting news for January of 2025. Effective 1/25, you will have access, if you have your dependent will have access outside of New Mexico if they are 17 or 26 years of age, between those ages, and they reside outside of New Mexico. They will have access to the network, Aetna network, outside of New Mexico. Now, again, the Aetna network is not available to dependents that live inside of New Mexico. It's for those dependents 17 years of age to 26 that reside outside of New Mexico. So how do you seek services outside of New Mexico? So when you go to the aetna.com/ASA website, those providers are contracted with Presbyterian, and your dependents will have access to those providers at the in-network level of benefits. What does that mean? Just as if you were at home, if you go to a primary care doctor that's contracted with the Aetna network, or if they go to a specialist that's contracted, or a facility that's contracted with the Aetna network, those will be paid at the in-network level of benefits. Now, will your dependents receive a new card? Absolutely, yes, they will. The new card will have the Aetna logo on the back of the card. So that is how those providers will identify you, your dependents, as an Aetna network member. Now, let me back up a little bit. You are a member of the Presbyterian Health Plan through APS, right? And all of your benefit questions, customer service, claims, that will all be paid by Presbyterian Health Plan, because that is your Presbyterian is your health plan. That's where your benefits reside, and that will be your home base. But you will have that card that will, again, let them know that you have access to the Aetna network outside of New Mexico. Now, again, those benefits, when you seek those services with those providers, will be paid at the in-network level of benefits. And if there's any questions on, well, should my provider file the claims with Presbyterian, or should they file them with Aetna? No. Everything's filed through Presbyterian. Coverage comes through Presbyterian, and the authorizations come through Presbyterian. So please have them look at the number on the back of the card for any authorizations needed or any benefit information.
Yeah, thank you. And we just the real simple. The Aetna in-network access is only for dependents living outside of New Mexico, age 17 to 26. So really nothing else about your Presbyterian plan as it pertains to in-state New Mexico has changed. Your providers haven't changed anything. We're just offering this extra layer of access for those employees who have dependents outside of New Mexico. So you can rest, it's just nice knowing that if you have dependents outside of New Mexico, we now are offering a solution for that. But that's only for those dependents outside of New Mexico. We just don't want anybody to get confused with that on their card or anything like that. So it's a great new service we get to offer for those.
Absolutely.
Yeah. So we're excited about that. Thank you, Ida Marie.
Of course. So we talked about how you can seek services at a lower out-of-pocket for those MRIs or CT scans. So when you go to a standalone facility, and the example of that would be Radiology Associates in Albuquerque or anywhere in New Mexico, or X-Ray Associates, that's going to be a way to tell whether you're going to have that higher out-of-pocket, the deductible plus coinsurance, or if you're just going to have that $120 copayment for those services. That's how you can tell, hey, how can I get that lower out of pocket? Go to this information on the website or on the brochure that I will have available to you at the open enrollment health fair with APS. You can pick up a pamphlet and it'll have all of the information of how you can seek services at your lower out of pocket cost. Now, we're very excited to announce that we do have a new press now available for you. We now have four centers of facilities, personnel facilities available to you. Now, these facilities are 24/7 urgent and emergency care services. You will only pay the out-of-pocket for the services that you are provided to you. So for example, if you go in and you're seen for, you're triaged by the nurse, they're going to let you know at that time, your visit is actually just an urgent care visit. The services that you will pay for today would be the urgent care copayment. Now, if those services are a little bit more to do with emergency care, then they'll let you know at that time too, so that you are not surprised at the end of the visit on what your out-of-pocket will be. Now, those facilities can see you for emergency services. So for example, if you need a CT scan, they have the services available there for you. They have the labs available there for you. So anything that you are seeing in an urgent care and emergency care settings, they do have there for you. So you don't have to worry about being transported. Now, there will be times, for example, if they need to stabilize you, or you will need to be inpatient, they will have you transported. But this is a great facility to go to 24/7. It's a lot less congested for you. You don't have to go to the emergency room, because a lot of times that can be a very long wait. And it's convenient. So the newest facilities that you have available is on Manal. And it's 24/7, but the best thing about this is that our kids never get sick really during the day, right? It's always in the middle of the night. We do have pediatricians available at every facility 24/7 for you to seek care for your children. So the options for no out-of-pocket cost is awesome, because, times are tough and we always want to make sure that we budget accordingly. So you have available to you the 24-hour nurse advice line. We have 24-hour visits that I'll talk to you about in just a moment, how that works for you. You have My Chart when you go to a Presbyterian or are seen at a Presbyterian facility, and you can seek services through the portal, and I'll tell you how. So Nurse Advice Line, they are available to you 24/7. These nurses can answer any questions that you might have, triage questions, or if you go to your Press Now or your My Chart page and you're looking at your lab results and you're not sure you're taking these certain medications and you're not sure how they're going to interact with what what your new Presbyterian, your new physician has given you or prescribed to you, these nurses can answer these questions. How is it going to interact? If I am having an interaction and I'm having, getting headaches and they've just changed my blood pressure medications, they actually have access to your records if you see a Presbyterian physician. So she can go in there, or they can go in there and look at your prescriptions and take a look at what you were prescribed and what you were changed to. So they'll be able to help you maybe decide, hey, I need to go see my physician. These two are interacting. And they can see if you're seeing a specialist with Presbyterian and you're seeing a primary doctor, they can see what those two providers have prescribed to you so that they can better assist you in knowing if maybe that is what's interacting or giving you the symptoms that you're having. That's zero out of pocket, 24/7. Video visits, you do have access to video visits. That's a zero out of pocket for you. And these physicians you can make an appointment. These are for urgent care visits. And this is through our national carrier. And I'll talk to you a little bit about how that works for you in just a moment. MyChart, you can get your prescriptions refilled. You can take a look at your lab work and you can message your provider. Sometimes the providers can just answer something over your MyChart and you don't have to go in. So it's very convenient for you. You can do it while you're at home or you're at work. Zero out-of-pocket care for you. Now, how are we improving access? We all know that access is very rationed, not only in New Mexico, but all over the country. So what are we trying to do to better your access to care? So we now have virtual visits for primary care, urgent care, behavioral health, and dermatologist. So let's talk about how you access those providers and how we're trying to reduce the barriers for you as a member. So what I'm going to let you know is not only do you have access to primary doctors Monday through Friday, 7 to 5, you can schedule an appointment. You can establish with a provider virtually. So you don't have to go into the office anymore. You can find a provider that you can see every time you make an appointment for a virtual visit. So that's awesome, because typically you see a provider virtually and then you see another one, next time. So you can establish with the primary doctor. They can do preventive visits. They can help you talk about your medication management, go over your lab works for you. Quick and zero referrals needed for this. You just simply make your appointments online, and I'll go over that and how you do that in just a moment. Same thing with the urgent care. You can schedule an urgent care appointment. This is great because I have a grandson that we use this for when he gets a cold, or we're not sure if we should take him into the doctor's office, and we don't really want to get him dressed and going where there's sicker children, right? So you can schedule urgent care virtual visits. Expanded hours, 7 to 7, Monday through Friday, but you can also see providers Saturday and Sunday. And again, I will have all this information at the open enrollment health fair for you. And I will also have those available for APS to post on their site. Now let's talk about your video visits. This is the national carriers that we use, national providers that Presbyterian uses. Now this is all over the country. You can use them wherever you are. These are physicians that are contracted with Presbyterian. This is zero out of pocket to you. Okay, so that's the difference between your virtual visits when you see a provider at a Presbyterian facility, which I just talked about for urgent care. These providers are national. You will see a physician that's contracted with Presbyterian 24/7. That's also another difference. The timing. You always, again, you don't know when you're going to need it, but you do have access to that service, zero out of pocket as a Presbyterian member. There's two ways to seek behavioral health care: virtually and in person. And a lot of us feel safer and more comfortable doing this at home. So you can do that with these virtual visits, behavioral health virtual visits. Now, I'll talk about how these work for you. So first of all, virtual talk therapy. There's several things, not only your own behavioral health that you can talk about, but if you have questions regarding just things, you never know. There's things out there, or you have PTSD, or you have questions regarding a family member that's going through something, anything that you feel that's out of the ordinary, that you feel comfortable talking to somebody about anything, virtually talk therapy, it's a great way to answer a lot of questions just in general. Doesn't have to be a personal questions, it can just be in general. So this is a great tool to use, and you can call them, schedule that virtual appointment, and I will go again into how you do that in just a moment. Dermatology has to be one of the most difficult specialties to schedule appointments for. You now have available to you appointments virtually for dermatology. So again, those are as expanded hours for you. We do have Mondays, Wednesdays, and Thursdays available. As you can see, the hours they're going to differ, and because what that means to you is these providers that are with dermatology are setting aside that time for the virtual appointments only, right? So they don't want to take away from the folks that go into the office. They now have office hours for virtual visits. Now they can take a look at moles on your skin, or they can take a look at your acne, things of that nature, and treat you. So if they feel that you have a mole that's questionable and they maybe want you to come in to be seen, they will schedule you for that appointment, possibly a biopsy, but they will be able to get you in within 2 weeks of that virtual visit appointment. So this is a great way to, again, establish yourself with dermatology, get seen quicker without having to go in to a provider. Now, how do I get access to those visits? How do I find virtual information? So you go into the new URL at the phs.org/virtual care, and you choose the specialty that you want to see. So for example, you click on the new phs.org virtual visit website. You'll have the options to choose. Do I want virtual urgent care, primary, or dermatology, or the talk therapies? Just click on what's going to work for you and what you want to schedule. Now, here are the other options for you if you want to take advantage of the no charge out-of-pocket services, Press RN, video visits, and the talk therapies, which are zero out-of-pocket. It's part of your behavioral health benefits. You can choose that as well. Now let's talk about your CHW workers. Great team of folks available to you. They also take care of the community. So these folks are available to you and will be there at the the open enrollment health fair to answer any questions that you might need. The way these folks work with the APS population is they're there to help. For example, if you're not sure who to go to for behavioral health services, community services, for example, they can tell you, food insecurities. Where can I go if we have somebody that that has a food insecurity? They can let you know how also you can talk to a member advocate if you need help with. So the member advocates are there to help you find a provider, help you make appointments for your provider, or answer any questions that you might have regarding the providers available. So they are an extension of your health plan, and they're there even if you want to refer somebody that you work with that hey, needs a little bit of help. For example, if they need some help with payments for their P&M bill or their gas bill, they can help find those services available or those programs available to help these folks. Now, these are self-referrals, provider referrals, or community referrals. So please, those folks will be there for you to talk to if you have any questions or concerns. Now oh, sorry. So again, we just went over what those folks are there for you, but these are certified workers, that community healthcare workers that again can help you with programs, peer specialists, family peer support, but also they have case management. So for example, if you're dealing with diabetes or you have other chronic conditions that you need help, whether it be to find providers, or you need help with, you have questions regarding your diabetes medications or things of that nature, these folks can help you find a case manager that can help you with manage your care for these symptoms. Your health and wellness programs. APS takes a lot of pride in helping you with your wellness, and they want to make sure that you have the programs available for that. So you have several programs available through the new platform, and the new platform is Personify Health, previously Virgin Pulse. And the way that works for APS employees, and there's several programs available, but one of the programs that is available is you can do challenges within APS. So you can do walking challenges, you can do diet challenges. They have different challenges during the year. So Becky is really passionate about that program, and so are we. We don't want to make sure that you stay healthy. So you can log into the Personify Health, and you can win up to $150 in rewards. Cooking classes, yoga classes, several different classes that you have access to. And we want to make sure that you take advantage of that program. But the new launch for the Personify will be January 1st.
Yeah, and I'll just say it's the same program, just a different name, because obviously there's a lot for people to keep track of.
Correct.
Same program, different name. So you won't have any issues. You won't have to re-log in. It's just going to have a different name. That's it. So
yes, it'll be seamless for you.
Yeah.
So again, you have mindful meditation classes, great libraries of just different stress relievers that you have available to you, great cooking classes. So not only are these live, but Becky does have those available to you on the APS website. If you want to go in there, they help you with nutritional cooking classes, easy cooking tips, so that you don't have to make this big, huge, elaborate dinners. It's simple, healthy meals available to you. And one of our wellness folks, Anna, she is a person on the videos that you'll see. Great gal, and she's great with healthy eating, and she's very she's good at what she does. She just really keeps it fun for you. And then there's health coaching. So if you want one-on-one coaching, if you're trying to accomplish some sort of goal within your new health venture, we do have health coaching available to you as well. And they will also be available for you to speak to at the health fair. So you do have the Fitness Pass available to you with Presbyterian, and what that is for you. The Fitness Pass offers you several gym options, several workout options. So you have the option to use Define Fitness all over the state of New Mexico, the Prime Fitness gyms, which are, for example, hundreds of contracted gyms, but not limited to Planet Fitness, Choose Fitness, Planet Fitness, Choose Fitness. Oh, lost my train of thought. There's hundreds of providers available to you to see within that network of gyms. But the way that that's going to work for you is you go into the primefitness.com. You'll find all of the gyms that are available to you. You choose one, you go to it. You're going to see that, for example, Planet Fitness offers the Black Card or the basic membership. So with Presbyterian and your Fitness Pass, you'll have access to the whole gym, so all of the equipment within the gym. If you want to upgrade to the pizza parties or haircuts or the massage chairs, What you'll be responsible for is just the difference between that amount that they pay for their membership. So, for example, the regular membership with Prime Fitness or Planet Fitness is $10. Now, if you go in and you want to add those services as a Prime member, Prime Fitness Pass member, you'll only pay the difference, which would be the $10 amount. At Choose Fitness, they have a smoothie bar, or they have team classes, right? The exercise classes, same thing. You'll pay for the Fitness Pass pays for you to utilize the gym, all of the equipment. But if you want to upgrade to that smoothie bar or the classes, you'll pay the difference of the amount of the membership. Now, Define Fitness, you get everything included with your Fitness Pass. So you have the team classes, you have the swimming pool, the sauna, and the jacuzzi available for no more. You don't have to pay anything extra out of your pocket with that gym. With sports and wellness, you get a discounted rate. So you have a discounted rate with the Fitness Pass through that membership with sports and wellness. The access is going to be based on the tier level of benefits within that gym. So you'll just need to talk to the folks there, and they'll let you know what access you have with the Fitness Pass membership through Presbyterian. The great thing about this Fitness Pass is that you pay one fee, right? And you can choose to go to Define Fitness in the morning or all of the gyms within the Prime Fitness network in the afternoon. So if I want to go to Defined and go swimming in the morning, and then I want to go to Choose and go to the smoothie bar or go take, one of their classes, you can do that. You don't have to choose just one gym. You can choose whatever gym you want, and that is included in the $27.50 per member per month, beginning January 1st of 2025. The current membership is $22.50 per member per month. The great thing about this as well is that open enrollment is at any time of the year. So if you're not ready to take that leap in January, you can enroll February for a March 1st effective date. So if you want to enroll February 2nd and you want to start going to the gym March 1st, you can do that. You will be locked into a contract just until December of that year. So if you decide, you know what, this isn't for me, I don't want to renew my membership, you don't have to do anything. It'll terminate December 31st. If you want to re-enroll for the next year, then you will start getting communications in November to just remind you, hey, it's that time of year, you'll need to re-enroll in the Fitness Pass online. Now, when you enroll initially, it's going to ask you for your credit card or banking information. The payments will come out of or be debited from your banking information that you enroll with at that time. You will have access for your spouse or any dependent 18 or over. You can enroll them at that time. The enrollment has to be through your subscriber. So the employee of APS will need to enroll their dependent or their spouse at that time. Now, again, you have access that'll come out of your own it'll come out of your own bank or out of your own checking account. It is not tied to your check with APS. So APS does not pull any monies from your pay period or paychecks.
It doesn't come out of payroll.
Right,
So
correct.
You will see the deduction on your pay stub. It comes, So just this is a service that's completely facilitated through Presbyterian. Presbyterian takes your banking or credit card information, and that's how the monthly fee is
withdrawn.
We do get that question quite a bit, Ida Marie. So thank you for bringing that up.
Of course.
Keep moving on.
So this is how you enroll. You go onto your MyPress account. You select My Health Plan, and then you go to the little guy, the wellness information, and then you press Fitness Pass. At that time, it's going to bring up who's eligible for services. So for example, it's going to bring yourself up. If you have a spouse on the account, and if you have dependents over 18, you'll be able to select either just yourself or just your dependent or just you and your spouse. Whomever you want to select and to have access to that fitness pass, that's where you'll make that selection or election. Now, it's going to be $27.50 per member per month. So always remember that when you enroll. Where do I go for all these answers to all these questions, all my questions? Because that was a lot of information, and we always tend to have those questions after the fact. So a couple of ways to do that. You have access to your dedicated member service team located here in Albuquerque. You can always call them Monday through Friday, or you can email them and ask them any questions that you'd like. Now, you also have access to the phs.org/APS page within the Presbyterian site. That'll take you to your specific benefits for APS. But we also have a lot of great digital tools available to you. You have access to download your ID card on your phone. You have access to My Chart. You have access to all of your information. That is your own personal medical record at your fingertips, either on your phone or on your laptop. It's always better to have it downloaded on your phone just because it's more convenient. And when you go to the facilities, you have that access if you don't have your card with you. It'll show you the front and the back of the card, and I'll show you in just a moment. So this is what the front of the card will look like, and then it'll give them the information of the back of your card as well. So always have that downloaded and ready to go when you go to the doctor's offices. You also have coverage information. If you have, those questions we've just talked about, what is my copayment? What is my deductible? How do I see that information? You go to your coverage page on that website, and it'll give you all of your plan information. Claims information. If you go to the doctor's office and they say, hey, you owe this much money, and they want to collect from you for that claim, you can always pull that up and say, hey, wait a minute, I see that it's pending. It hasn't quite gone through the system yet or through the process. Let's wait a little bit longer to make sure that it goes through the process and it's paid, so that I know what my actual out-of-pocket will be. So that's a great tool to use for those services. Your wellness information, and we just talked about that, how you can log into your fitness pass, right? But you can also log into the Personify page that's available to and for the APS members. You go to the MyPress account, you select My Health Plan as you would, and the page is going to look a little bit different for APS employees. This is what it looks like for non-APS employees. But when you go to your personalized page, you'll see APS information.
And just so they know, it's called Wellness at Work. The platform is Virgin Pulse /Personify Health. So what you'll see is a Wellness at Work kind of link, and that Wellness at Work is the title of the well-being platform. It's kind of like the title of the program that the Solutions Group hosts for us. So we throw around so many different terms.
Correct.
But on that page, it'll say Wellness at Work, and that's your wellness incentive program, and it links you into the platform, which is Virgin Pulse, soon to be Personify Health. So we just, we're just going to throw it all at once. But thanks. Oh, there we go.
So there's a lot of information. Please come to the health fair, the open enrollment health fair next week. We will be able to answer any questions that you might have, but not only that, we'll help you download that app on your phone so that you'll just have it and you'll be able to utilize all the tools that are available for you.
Thank you for mentioning that, Ina. I was just going to say, I try to tell whenever I'm in staff meetings to let people know it's really important just to download your health plan app. It's just a wealth of information, and
right.
It is your resources at your fingertips, and it's so much better to be prepared when you need those virtual services or those video visits or the nurse line. When you need it, you already have it, and you don't have to go fumbling around trying to find it, especially if you're not feeling well or a loved one's not feeling well. So please make sure you download your app, the Presbyterian app. It's a great resource for you to have. And that's the first step in being proactive in our pursuit of health and well-being.
Absolutely.
Yeah, knowing our benefits. So next week is the Health and Wellness Fair with assistance for open enrollment. Ida Marie and her team is going to be there, and I do encourage you to talk to them. They have the community health workers. We're going to have health coaches and wellness coaches there. It's just a really great place for you to get all, in-person support all in one place. And to be proactive in our pursuit, these are the kind of events that we need to attend.
Yes.
Let's get it all done. We have mammograms, eye exams, blood glucose, cholesterol screens, and a lot of other really fun things from local businesses that we're going to have there. So thank you so much, Ida Marie, for this presentation. Really informative. And we thank you all so much for tuning in. Just so you know, whoever's listening and whenever, this presentation does serve for new employees as well, and new employees in 2025. This presentation is completely relevant outside of the open enrollment and wellness fair. Everything that Ida Marie presented is relevant for your benefits in 2025. So thank you again. And I'm going to stop recording, and you all have a wonderful day. Thanks for tuning in to us or with us. Here we go.